Hi, good afternoon. I'm Dr. Zunaid from Elite Aesthetics, and today we're discussing an 8-point facelift or a liquid facelift. So what is it? An 8-point facelift is really a treatment where you have very strategically placed filler at 8 different points in the face. Now these 8 points are chosen because those are the areas where volume is lost the most often when we age. So for example, you're looking at 2 points up at the cheek, up here on the lateral cheek or the side cheek. Your third point would essentially be in the mid cheek or the anterior cheek or the front portion that you can that you see head on, which helps to support the tear trough. There are further points underneath the cheekbone over there, and to help the jawline and also to help the jowl. And the last 2 points are actually in the nasolabial fold and actually in the corners of the mouth. So these are the 8 points that that the development of the skill has actually shown that if you do filler in those areas, it actually helps to provide a good kind of liquid facelift, a good freshening to the face. So the next question is, what filler is used? We tend to use filler that is essentially thicker than normal, and it means it's more cohesive, it's more elastic, and it's also injected into areas where it is required to last long because it is used to give a lifting action in the face. So examples of what we would use for this would be Teoxane RHA3, Teoxane RHA4, Teoxane Ultra Deep. We could use Stellage M, we could use Stellage L, and Stellage XL. So how many fillers do you need? It depends on the degree of volume loss, but you're looking at quite possibly up to about four syringes of filler in order to get the best possible result. And the grades of filler, the thickness of the filler might differ in terms of what we need to do. So for example, some people might need it a little bit more in the upper cheek, so they will need a slightly thicker, denser, more elastic filler up there with a softer filler down in the lower parts of the face. How long does it last? It would last for the same duration as the filler, so you're looking at possibly in the region of about 6 to 9 months. Once the filler is out, this is a very common question that we get asked, once the filler is out, the face doesn't completely sag worse than it did before. Something very positive that we find that comes out of it is that patients find it a good opportunity to start engaging in other treatments. For example, hydrofacial. They might need microneedling to resurface the skin, and certainly a good range of medical grade cosmeceutical skincare is always advised after a treatment like this. Where is the filler injected? So I think we've discussed that. We might use a combination of either cannula or filler if we are in high risk areas, or if we are in areas that are very likely to bruise, or for example if we have patients who are on anticoagulants, or patients who are easy bruisers, or patients who bleed a lot, we may opt to use a cannula in those areas rather than a needle. But it's all designed to make sure that we get the best possible result with minimal trauma to the skin. The last question that we had in the FAQs is who is suitable. So I would say patients in the region of about 30 upwards. We find that patients may come to us before a function, perhaps before a wedding that they're attending, or perhaps one of their children's weddings, and they just want a little bit of a freshen up. It's also very good for patients who've never had any kind of cosmetic injectables before, for example Botox or filler, and they just feel that they want an overall fresh but subtle look. So those are generally the people who are suitable for it, males and females as well, because everyone loses volume with age. Men tend to lose a little bit more of volume in the mid-face from about the age of 40 upwards, and with females it's generally more the upper 40s into the 50s, but depending on the degree of volume loss which is assessed, which is the most important criteria. So anyone can have it